In a world that often feels divided, we forget quite easily what we can do when we come together.
Schistosomiasis is actually second to malaria in terms of its health impact.
Schistosomiasis affects 250 million people. About 50 million people are preschool-age children. There was no suitable treatment for preschool-age children. What we were trying to do is to fill this unacceptable gap.
Schistosomiasis is a neglected tropical disease. People who do not have access to clean water and sanitation will get contaminated by contact with fresh waters containing that parasite. So it's actually a disease of poverty.
Even the bigger economy of the country is affected a lot by these cases of schistosomiasis because children are not growing to their full potential.
We have found a way of bridging this important treatment gap.
There is a need for a new formulation, which is the one that we basically have developed, which is a dispersible tablet, which is much smaller, 150 milligrams.
小さなお子さんが飲むということで、まず錠剤のサイズを4分の1、今の錠剤のですね、4分の1のサイズに小さくしたっていったところもありますし、あとこのプラジカンテルが持つそのものの課題ですね、苦味っていったところが一番大きな課題ですけれども、その苦味を抑えるといった製剤工夫をしました。
It has a much better taste, and it withstands the very humid tropical climate in which this disease exists.
This is the first time a drug supported by GHIT from start to finish has made it into the hands of the people. So it proves that our model, investing in innovation, building partnership, and staying the course, can deliver the impact.
To reach elimination of schistosomiasis as a public health problem by 2030, all age groups need to be treated. And there was a critical gap in the children below 6 years old that did not have a suitable treatment against schistosomiasis till now. We've gone through African-based clinical trials. We are now at the point of having it accessible to the kids.
Medicines are valueless without access. GHIT was founded based on this guiding principle. It's been a 12-year journey for us. GHIT's been funding this program since its inception, over a decade long of commitment.
Commitment is about not stopping at the initial plan.
From Japan to Germany, Brazil to Africa, every partner brought their piece of the puzzle.
Astellas led the formulation. Merck optimized it and has been responsible for clinical development programs. Pharmagenius manufactured the clinical supply, and Universal Corporation in Kenya will soon manufacture it at a large scale.
I'm convinced that what we have achieved could not have been achieved by one sole organization. Partnership is really the way to do it.
Global collaboration is more important than ever. This is GHIT's strength.
It is about collaboration. It is about getting the local context, and you can only get that from local partners.
GHIT, Merck, and their various partners of the pediatric praziquantel consortium have shared for the longest time the same mission and the same commitment toward elimination of schistosomiasis as a public health problem. Global collaboration is a must. It's a requirement to address those extremely complex and difficult health situations for low and middle income countries. This program has been a journey, a technical and human adventure. It has taught us how trust, agility, and tenacity can lead to success. GHIT has played a tremendous role in terms of supporting and helping this new access model. This is actually a model that does not exist at scale for NTD products. We are actually framing the blueprint for other products to come.
におきましても GHIT のファンディングのサポートがなければですね、これはできなかったことだというふうにパートナーメンバー含めてですね、皆さんそう思っています。感謝しております。
For the first time, preschool children can be treated very effectively. This means fewer children suffering, more futures protected, more socio-economic benefits for countries.
This moment shows that Japanese leadership and international cooperation can achieve something extraordinary, and it inspires us to keep going.
小児製剤は私の過去の中で本当に一番思い出に残っているプロジェクトであります。
We believe a world without neglected tropical disease is possible through the power of partnership. This is not the end of a journey, but the beginning of a new one.
There's an African proverb that says if you want to go fast, go alone, but if you want to go far, go together. And I think that exemplifies the work that we have been doing, and that's how we have managed to come thus far.
GHIT Fund. Fight neglected diseases through partnerships.